Okay, it's Dr. K here. Welcome back. In this module, we're going to talk about some complementary and alternative therapies that are available to patients. So this slide is showing you the spectrum of what's available in terms of complementary and alternative medicines. We're going to focus on the biology-based practices, mainly the herbal products in this module. So just some definitions here. So complementary medicine means that it's being used in addition to a traditional medical approach. Alternative medicine it's being used instead or in replacement of a traditional medical approach. And when we're seeing patients, it's not that we need to put down their different alternative medicines or complementary medicines that they're doing. All we can do is provide evidence and facts about the different medicines that are available. So patients often will come in taking alternative medicines or complementary medicines, and I'll often just make sure that they don't interact with the medications that they're taking or being prescribed from a traditional point of view. And also talking about them in terms of the safety of the medication, the complementary alternative medication that they're taking. Some of these can be extremely expensive. And for some people, the financial burden can be very high. So sometimes I'll talk to them about really the need for doing this when it's financially not feasible. So, but a lot of them are very reasonable complementary and alternative medicines that can be used. So let's just look at alternative a bit here. So we're both of them. So alternative medicine is typically it's outside of the mainstream medical approach. And often it's individualized. You may go and see someone that may prescribe you different herbal remedies or a combination of different plant-based remedies. So there's all kinds of options that are available. And for many patients, they derive a lot of psychological benefit by being treated as a whole, right? Seeing someone that's treating them as a whole instead of seeing someone that's just treating their heart condition or their kidney condition. They prefer to see someone that's really seeing them as a whole organism as opposed to a heart or a lung or a kidney. So, but remember, herbs, supplements, vitamins, they all have potential side effects, just like any medication that we prescribe. Okay, and we'll go into some of these. And the other thing about these medicines, whether it's complementary, alternative, is that they don't need to meet the same standards as mainstream drugs. They haven't had to go through phases of drug trials. They don't need to have the same scrutiny put on them as prescribed medications or mainstream medications. So this is just a bit of a history of herbal therapies, and they've really become popular. These are very common therapies for patients to be taking, right? So there's been a lot more interest in the past 30 or 40 years. They're very available now. You can walk down the food store aisle or the pharmacies, and there's so many different herbal therapies. And there's a feeling that they're more natural than typical prescription medications, so a lot of patients feel more comfortable taking these. Trying out more, quote, natural remedies for chronic conditions such as osteoarthritis, um, uh, chronic pain, chronic headaches, um, a lot of degenerative conditions that older patients get, decreased vision. There's vitamins for that. So a lot of older patients turn to these in addition to seeing a mainstream healthcare provider. And I think they're more recognized, and they're not uh, they're not put down or scrutinized as much by healthcare providers. I think nurses and providers are um, more involved in patients, or they're more tolerating of patients taking these remedies in addition to mainstream medical therapies. So it's definitely become more and more popular and more widespread use. So this slide is just mentioning that there is starting to be a bit of research looking into some of these herbal remedies. There's not a lot of trials on them, so we don't know the effectiveness uh, of of these herbal remedies. They haven't had to go through placebo, double-blinded trials that compare them with, a placebo drug to see how effective they are. So it's hard to give advice on some of these drugs when we don't really know the facts about how effective they are. So I mean, this slide is just having, poking a bit of fun with acupuncture. But in general, when someone tells me that they're having acupuncture, or they're going to see the chiropractor, or they're taking a certain herbal remedy, I just ask them how effective it's been for them, even if some of it is placebo effect and some of it is actually um, the treatment itself. And if they find it very effective, or if they found benefit, then I think, and there's no danger to the patient in terms of side effects or drug interactions. I think we're much more tolerating now of accepting these different remedies. So in 1994, there was a dietary supplement regulation act where the dietary supplements had to undergo some regulation, much less rigid than the FDA, not held to the same standards. These dietary supplements are regulated by the FDA as food and not as a drug, so they don't require the same degree of scrutiny that a medication would require. Okay, and this is just a slide on dietary supplement regulation. So dietary supplements, so just the list of things that fall under dietary supplements. And you can see at the bottom, look at the use of some of these supplements. Uh, Fish oil, very high. Calcium supplements, vitamin D supplements, vitamin C, very high use of these different supplements. This is some of the weaknesses that have been historically happening with dietary supplements. The testing is often not required before marketing. Proof of efficacy, how effective it is to treat a certain condition, is not required by the manufacturer. Labeling not monitored for accuracy. So these have all been issues. Um, and patients can easily access these dietary supplements. and the advertisement may be a bit inaccurate, and the claims may not, they haven't been shown to be necessarily effective. So now you can see in 2007, it's been updated, where companies now need to include information to consumers about contacting if they're having adverse reactions to the supplements. The manufacturers now must confirm that there's some accuracy in the dosing, the purity, the potency, and what's actually in the capsules, for example. And also the FDA can now collect information on any serious adverse events from these supplements. Okay, I'll leave this slide to you, really just giving you a bit of a definition of what a herb is, and just a reminder that typically large amounts of consumption of herbs that we'll talk about can lead to potential drug interactions. So the safety of complementary and alternative medicines, and we're really talking about more the biologic ones, right? So the ones that patients purchase and typically take orally. Natural doesn't necessarily mean safer. It can still have a lot of active ingredients that can cause significant side effects. And also these ingredients can cause significant interactions with medications that patients are already taking. Okay, so we're just going to discuss briefly herbal drug interactions. Like any medication, starting low and going slow in terms of the dosing of the medication is always best practice. Now, if someone's taking an antibiotic for a week, we typically don't start low and go slow because it's a fixed dose and it's for a short duration. But medications that are used for longer periods of time, months to years, it's always a better idea to start low with the dosing and to gradually increase it. And an example for that would be antihypertensive medications. We often start at lower doses and gradually go up as we have patients follow up, recheck the blood pressure, and determine that they require higher doses, and then gradually increase the dose. And it definitely reduces side effects and adverse effects, typically side effects, when you start at a low dose and you gradually climb. Patients don't tend to come back and be intolerant of the medications as much as starting at a full dose. Okay, so when we think of herb drug interactions, there's synergistic effect or reaction, and a synergistic reaction means that the two chemicals taken together are even more powerful than the separate sum of each chemical. So it's like 1 + 1 equals, say, 5. They have synergistic effects. The second one is just additive effects, where 1 + 1 = 2. The effects of both chemicals are just additive to each other. And finally, antagonistic effects is that the herbal remedy is counteracting the other medication. So it has antagonistic effects. Okay, I'm not going to spend much time on this slide. This is information for you to read in terms of keeping up to date with herbal medications, recognizing the names, recognizing some potential side effects that the herbal remedy could cause, and also drug interactions of the herbal remedy. Okay, so this slide is really just intended for you to have an idea of the interactions between herbal remedies and traditional medications. The intent is not for you to memorize the slide. I think memorizing this won't be useful. It'll be in a book for you to refer to later. And many of these medications you haven't studied yet, so there's no benefit just to memorize this information. Okay, so here's the first prototype slide. So this is we're in a module that's relatively straightforward in terms of the information and in terms of the content. It's relatively light, which is good. And we're starting this way, so just to get you introduced to a prototype slide that you'll see throughout the semester. So this first one's on aloe or aloe vera, and typically we have these slides as indications, actions, adverse effects. So that would include side effects and adverse effects as well. Contraindications to the medication, and then nursing considerations or nursing care. So let's look at aloe a bit. So what do we use aloe vera topically? So the ointment or the cream or the gel. So most of us may have, well, a lot of us may have used this for sunburns. So painful burns from lying out in the sun a bit too long or being in the water too long. It can also soften the skin, and sometimes patients with psoriasis can put it on thickened plaques to soften the plaques. And orally, it's used as a laxative. So it has laxative effects for constipation. So the actions, so it's a bit of an anti-inflammatory, and that's why it's effective for solar burns. You know, when you've been out in the sun too much. And the other main one would be its laxative effects. I think it has mild analgesic effects. I haven't seen anyone taking it for analgesia, more so for laxative when given orally, or definitely as a gel for a sunburn. What are the adverse effects? There won't be many, right? It's pretty well tolerated. But if you think about it, well, there's a patient taking it for constipation. What could happen if they took too much aloe vera, or if they're very sensitive to it when taken orally? Well, it could turn into diarrhea. And if you get diarrhea because of a laxative, any laxative, whether it's this one or a whole host of other laxatives that we'll talk about later, then you could potentially lose more fluid than you wanted to. And with fluid goes electrolytes from the body. So sodium, potassium, chloride. So you can get some fluid and electrolyte imbalances. So contraindications. So sometimes we just know contraindications from patients that have been taking a herbal remedy or a complementary or alternative drug, and then they come in with a certain condition. So aloe vera has been linked to being potentially nephrotoxic. So it can be hard on the kidneys if taken for a long period of time or in high doses. In terms of cardiac disorders, I think the main thing here is it can upset the electrolytes in the body. And if you have a drug that can upset the electrolytes, for example, potassium is the big one for the heart. So whenever you hear low or high potassium, your mind should always go to cardiac arrhythmias, because the heart is extremely sensitive to changes in in too high or too low potassium. Okay, so abnormal potassium levels equals cardiac arrhythmias. Okay, so I think that's why that one's listed there. So under nursing care, orally, so topically, really there's no side effects. Okay, orally, it can lead, as mentioned above, or we just spoke about, to a lower potassium from potentially the diarrhea. And so patients that have cardiac disorders are often on diuretics, which are water pills to drain you of water because they have heart failure and they have too much fluid in their system. So they're on diuretics. They're on a drug called digoxin, which can help with pumping of the heart. So abnormal potassium levels do not get along with digoxin at all. It actually is dangerous. So low potassium, hypokalemia, and digoxin is a terrible combination. The other issue here is that diuretics often drain you of potassium um, by diuresing you, taking fluids and not reabsorbing them in the kidneys, so draining you of some fluids and electrolytes such as sodium, potassium, chloride, magnesium. A lot of electrolytes are flushed into the kidney, into the bladder, or out of the kidney with diuretics. So that's the cardiac side of why you'd want to be a bit careful with aloe, because of the diarrhea leading to low potassium. So just educating patients about the potential of fluid imbalances, electrolyte imbalances, because of the laxative effect of aloe vera. Okay, so what about the effects with warfarin, which is a powerful blood thinner? Well, it really comes down to the fact of diarrhea again. So aloe can cause diarrhea. Diarrhea can cause you to be dehydrated. And warfarin can have a stronger and more powerful effect due to the volume depletion. Okay, so that's the interaction. It's not that aloe is a blood thinner. It's that it can dehydrate you a bit if it causes diarrhea, making warfarin more powerful at whichever dose they're taking. So if you were to think of aloe, I would think of, okay, it causes diarrhea, and all of its problems, except for the kidney one, are linked to the diarrhea and low potassium and the dehydration that could occur, leading to a lot of its side effects. So this next herbal remedy, black cohosh, is typically used by women for menopausal symptoms, such as hot flashes, which often occur around the age of 50 to 52, when menopause is the average onset age of menopause. It can also be used for hormone-related symptoms of premenstrual cycle. So women can get symptoms with their monthly cycle, and some women use black cohosh to help with symptoms. The action is really unknown. We think there's some estrogen effect to this particular herbal remedy. It's not completely clear. So the effects, remember, many medications you're going to see GI upset and headache, and it's hard. Most medications have the potential to cause a GI upset. Some of them much more than others, and they'll likely be stressed through the course if it's a really prominent side effect. So let's just look along here and the adverse effects, and we see vaginal bleeding. Well, that kind of makes sense. If it has estrogen effects, then it can potentially stimulate the uterus and cause some vaginal bleeding. It also has some potential harm to the liver, especially in high doses. Um, Remember, many drugs are hard on the liver because that's where they get metabolized. So there can be liver injury as well. Blood thinning effects from black cohosh is also well known, and we'll talk about that in a minute. So what are the contraindications? Well, pregnancy, definitely if they have estrogen effects. If black cohosh has estrogen effects, we don't want to be adding it to someone who's pregnant. Breast cancer, since breast cancer can be accelerated by giving estrogen type medications. So we would definitely avoid it in breast cancer. Kidney and liver disease would be due to liver disease. If a patient has liver disease, that would be a reason to avoid this medication or this herbal remedy because black cohosh can irritate the liver. Kidney disease, it would be avoided or contraindicated because it wouldn't be excreted very effectively. So what about the nursing considerations or nursing care? Well, black cohosh can increase the effects of some antihypertensive medications and also estrogens. So as an example, you wouldn't take this if you were pregnant. You wouldn't take this if you were on the birth control pill, since they already have estrogen within them. It can increase also the potential for low sugars, hypoglycemia in diabetic patients that are taking insulin. So it can aggravate sugar control in diabetics. And we would avoid black cohosh with other medications that can irritate or cause the liver to have a mild hepatitis or inflammation of the liver. And drugs such as statins that we use for cholesterol, or acetaminophen, which is metabolized by the liver, or methotrexate, which you'll hear about later, is a medication that we use in chemotherapy. It's an immunosuppressant that's used for autoimmune diseases such as rheumatoid arthritis and lupus. Okay, lastly, just to remember that many of these herbal remedies you're going to come across during this module have blood thinning effects, and this one also has blood thinning effects. So we wouldn't combine this, or we wouldn't want to see someone taking this while they're on blood thinners. So whether that's aspirin or some of the more powerful blood thinners such as warfarin. These herbal remedies have to be looked at a bit to see if they also have blood thinning effects, which can cause patients to have significant bleeding. Okay, so the next one, echinacea, very well-known herbal remedy, mainly used for typical cold symptoms, and it's felt that it activates and boosts the immune system. Remember, when I'm talking about these herbal remedies, it's not based on a lot of science because I don't have a lot of science to base it on. So a lot of it's historical, some of it's based on some weak science, but these are some of the herbal remedies that you need to know about. Okay, adverse effects. Nothing really significant. A bit of a bitter taste with echinacea, but really very few adverse effects. Remember, when you see allergic reaction, that could go for any medication. So that could be actually removed from here, and it could just be assumed that any medication, herbal or all the ones we're going to talk about in pharmacology classes, can cause an allergic reaction. So under nursing considerations, trying to avoid echinacea with immunosuppressant drugs. So, okay, why would you do that? Well, patients that are taking immunosuppressants are usually taking them for a reason, and that's to suppress their immune system for some kind of autoimmune disease, such as rheumatoid arthritis, or Crohn's disease, or ulcerative colitis, or lupus. And echinacea potentially can interact because it's activating the immune system. So you wouldn't want to use this medication with immunosuppressants that are trying to suppress the immune system. As well, patients with HIV, tuberculosis, rheumatoid arthritis, cancer patients. Again, since all of these diseases, patients are taking medications that are altering the immune system. And echinacea, you don't want to add that to the mixture of medications they're taking because it'll confuse the effects of the drugs that they require for their illness. Okay, feverfew indications for this: migraine headaches, and an assortment of different types of arthritis it can be tried for. So we don't really know the action of this particular herbal remedy. It's felt to block a factor that is involved in migraine headaches, but we don't really know its exact action. We do know that it has some platelet inhibiting action, which we'll come back to in a minute, because if it inhibits platelets, we're probably not going to want to use it with blood thinners. Adverse effects, we just mentioned, it can aggravate bleeding. There's a condition called post-feverfew syndrome, and it can potentially cause a GI upset as well. So contraindications, well, here's where the blood thinners come in. Aspirin, non-steroidal anti-inflammatories, heparin, warfarin. You don't want to add to the blood thinning effect of other drugs. What's post-feverfew syndrome? So this can occur in patients that have been taking this for 6 months to a year, and then they stop taking this particular herbal remedy, and they can be left with the symptoms that they started with. So more headaches, sore joints, muscle stiffness, potentially some anxiety and fatigue. So this is after stopping this herbal remedy. So it's suggested not to stop it abruptly, and also to discontinue it weeks before any elective surgery due to its blood thinning effects. So garlic as a herbal remedy used for heart disease, so atherosclerosis of the coronary arteries that feed the heart. Now, atherosclerosis is the plaque formation that occurs in coronary arteries and causes gradual blockage of the coronary arteries. It's also used potentially to reduce cholesterol levels in the bloodstream and to reduce blood pressure in patients with hypertension. The action we're not going to spend too much time on. It's felt to have beneficial effects of reducing the bad cholesterol, which is LDL, and increasing the good cholesterol, which is HDL. And here we can see that there's some inhibition of platelets again, so it has some blood thinning effects. The adverse effects, well, okay, like many things, gastrointestinal upset, bad breath, body odor, those won't be hard to remember, and increased bleeding. Okay, so remember, a lot of these herbal remedies, it's a very common theme here with increased bleeding with other blood thinners. So the contraindications, well, as some other ones, NSAIDs, aspirins, heparin, warfarin, you just don't want to mess with these drugs and potentially cause more bleeding. Hemophilia, that's a condition where patients are lacking a certain clotting factor, and they tend to bleed very easily. Okay, so again, patients on blood thinners to avoid garlic and to stop prior to elective surgery weeks before. So the next prototype is ginger root. And notice that we don't have anything under similar for many of these because we haven't really gotten into mainstream medicines yet. So we're really just talking about herbal remedies. So ginger root is essentially used for nausea or upset stomach, morning sickness, motion sickness. And it's felt to increase gastric motility, meaning stimulate the stomach to move the food or fluid along into the small intestine and reduce the potential for nausea and vomiting. Notice it also suppresses platelets. So what would be the adverse effects? Well, it's going to be very similar. This module is relatively straightforward. It's nice. So increased bleeding with blood thinners. And this one also comes with the potential of causing hypoglycemia, dropping the blood sugar in diabetics that are taking diabetic drugs. And typically, the biggest offender of any diabetic medication that can make a patient hypoglycemic is insulin. Really? So if someone takes an incorrect dose of insulin, they are going to drive their sugars very low, potentially. A lot of the oral medications can drop the sugars, but not to the same extent as a dose of insulin that was higher than their usual dose that could really drop the sugars fast. Okay, so contraindications, again, it's going to be with all those blood thinners again, avoiding it in pregnancy, monitoring patients that are taking it, or telling them to monitor their blood sugars in case of hypoglycemia. And of course, avoiding blood thinners with it, or avoiding the ginger root while you're taking blood thinners. Okay, ginkgo biloba. So I'm starting to feel like a broken record here. So indications, so occlusive arterial disorders. So arteries that are narrowed. So you can have narrowing of arteries to your brain, to your heart, to your legs, all over the body. It has some blood thinning effects as well. So some patients take it for memory loss and Alzheimer's disease. And what's the action felt to be? Well, promoting vasodilation, so causing the blood vessels to dilate, to enlarge, decreasing platelet stickiness and aggregation, and increasing brain flow to the brain. So that's why it's felt that it could be tried for Alzheimer's or memory loss. There's not a lot of evidence that this has any significant effect. Adverse effects, there's gastrointestinal upset, a headache, and a possibility of seizures if taken in higher doses. Again, the main contraindications, it's going to be the blood thinners. Okay. Okay, what about nursing care? So remember, one of the main reasons ginkgo biloba is tried is for memory loss and Alzheimer's disease, but really it hasn't shown any definite improvement in these conditions. Definitely to consider avoiding this medication in a patient with seizures, since it can aggravate seizures. And of course, blood thinners. And I'll mention them again: aspirin, NSAIDs, warfarin. There's another one called Plavix, which is clopidogrel. You don't need to know them right now, but I'll just mention them so you hear them once, and then maybe it'll stick the second or third time you hear it. Okay, glucosamine, very commonly seen in the pharmacy. Many people take this to try and help arthritic pain. Osteoarthritis, which is the wear and tear arthritis that you get with the aging process, just getting older and using your joints, the cartilage just gradually wears out. Okay, and so what's the action that's felt to be beneficial? Stimulating cells to make cartilage and synovial fluid and suppressing inflammation within the joints. So that's the postulated action. I don't think there's a lot of evidence that it actually stimulates cells to produce cartilage, but that's the action that it's felt to potentially cause. So adverse effects, again, gastrointestinal, you can get some heartburn with it. And again, look at that, blood thinning, bleeding is there again. So it's almost like it's with all of them. Contraindications, mainly it's going to be antiplatelets and anticoagulants. So it makes it a bit easier because this is a very common theme with these to avoid with blood thinners. So nursing considerations, monitoring for bleeding in patients taking a blood thinner. Okay, so the next one is a herbal remedy called Kava, and it's used for anxiety type symptoms. So anxiety through the day or insomnia at night, difficulty sleeping, and also for general relaxation. It's felt that this herbal remedy works through the GABA system. So this is a system, it's an inhibitory system of the brain. So when this system is stimulated, it actually relaxes and inhibits the brain. So, for example, benzodiazepines, such as diazepam, lorazepam, use this system. They stimulate this system to suppress the brain and leading to relaxation and helping with sleep and reduce anxiety. And that's what Kava is felt to do by stimulating this system. So this is the gamma aminobutyric acid is a neurotransmitter that inhibits and suppresses brain activity, and anything that stimulates this system will also have relaxation effects. Okay, and that's why you see the actions of promoting sleep, decreasing anxiety, and muscle relaxation. There's a small potential of liver injury with Kava. It would have to be taken in large doses. Contraindications, avoiding it with other CNS, so central nervous system depressants. So taking Kava, say, with a sleeping pill, such as diazepam or lorazepam, wouldn't be a good idea. Taking it with a depressant such as alcohol wouldn't be a good idea because the effects would be additive. Okay, so under nursing considerations, sure, large doses can potentially cause some liver injury. So the liver function tests may need to be checked if someone's taking high doses and they come in sick. And also checking in with what other medications they're taking that can have sedative and relaxation effects, such as benzodiazepines that I mentioned, or alcohol. Okay, so next herbal remedy is St. John's wort. The main indication that you'll see patients having purchased this is mild depression. Not many patients would take it. It does have some analgesic effects, but not many patients would take it for that, since there's an assortment of other medications for mild pain. But definitely you'll see patients purchasing it for depressive symptoms. It's felt to increase serotonin in the brain, um, which can have antidepressive effects. It can improve your mood by increasing serotonin. And that's how many antidepressants that we'll talk about later work. Um, the adverse effects, I'm not going to go into them too much. It can cause a mildly dry mouth, a bit of lightheadedness since it works in the brain, and you can get a bit of a photosensitivity rash with it. In general, it's very well tolerated. What would be the contraindications? Well, definitely if you were taking a traditional antidepressant or any kind of a stimulant such as amphetamine. And why did we list amphetamine here? Well, children uh, sometimes are taking amphetamine-like medications for attention deficit disorder. So, definitely any medication that has CNS effects, you wouldn't want to add St. John's wort to the mixture. So under nursing care, teaching patients the potential for a photosensitivity rash, and also advising patients to review their medications with their healthcare provider, because this really you shouldn't be using with antidepressants, antipsychotics, or other medications, anti-anxiety medications. Okay. Saw palmetto is the next one. So really one indication for this. For men, it's tried in males to alleviate their symptoms of benign prostatic hyperplasia. So it's enlargement of their prostate, typically occurring in your 50s, 60s, and 70s, where you have difficulty with your urinary stream and getting up frequently at night to urinate. So it's felt the action can potentially decrease the size of the prostate gland. Adverse effects, there's the blood thinning again. So what would be the contraindications? So definitely you wouldn't want to take this with pregnancy. Again, you're not going to take it with antiplatelets or anticoagulants. Concurrent use with a drug called finasteride. Finasteride is a drug that we'll talk about it in a different module, but it's a medication that blocks testosterone effects and is used to try and reduce the size of the prostate in benign prostatic hypertrophy or hyperplasia. So it's a more traditional medication. So you wouldn't want to add this to finasteride, which is often prescribed. Now, avoiding use prior to prostate-specific antigen. Okay, so let me just talk about that for a bit. So prostate-specific antigen is an enzyme or a chemical that's released by the prostate in males. And when it's elevated in the bloodstream, there is a possibility that the patient is overproducing this prostate-specific antigen, or PSA, and that the overproduction may be due from a cancer. So we do use it sometimes as a screening test for prostate cancer. Now, if you're taking saw palmetto, which can potentially shrink the prostate, that could lower the PSA and hide a potential prostate cancer, because the PSA is now not accurately reflecting what's going on in the prostate. So that's the reason why it's saying avoid use prior to a PSA test. And also making sure that patients are not on blood thinners. Okay, so here's a very common medication for sleeplessness and anxiety, but definitely difficulty sleeping, patients will be suggested to try valerian. And look at the action. It stimulates the GABA system. Okay, so gamma aminobutyric acid. You don't need to remember the whole long names. So the GABA system is an inhibitory system of the brain that settles down the brain. Okay, so you can have stimulatory systems of the brain, like epinephrine would be a stimulatory system of the brain. This system, GABA, is an inhibitory to settle down the brain. So drugs that stimulate this system tend to help with agitation, anxiety, and insomnia. So the effects: drowsiness, depressive symptoms. Risk of dependence would be relatively low with valerian compared to other medications that we use for sleeplessness and anxiety that can be very habit forming. Contraindications, well, pregnancy and breastfeeding, sure, it can have sedative effects, so it wouldn't be a good idea. Adding CNS depressants or alcohol, which is also a depressant, with valerian can magnify its effect, so they should be avoided. Under nursing care, caution in mental health disorders, just because of its effect on the brain. And these patients can be on other medications that are affecting the brain, such as antidepressants, anti-anxiety medications, and antipsychotics. And remember that this will definitely add to any CNS depressant drugs. So if a patient is taking other relaxants or other sedatives, it wouldn't be a good idea to add valerian.
Okay, so let's look at omega-3 fatty acids. And some of them are essential, meaning the body doesn't produce some of them. Okay. Um, so as a supplement, these have been studied for a number of conditions, and the jury is still out whether they have a lot of effectiveness at reducing certain conditions, such as cancer. Where they have been shown, or where there has been some evidence, is in cardiovascular disease. So reducing the risk of heart attacks and strokes, and also potentially used in elevated triglyceride, so hypertriglyceridemia, high triglycerides in the blood. So where do we find these omega-3 fatty acids? Typically in fish oils. Salmon is very high in omega-3. Some plant oils are quite high in omega-3. The other potential indication or use is in inflammatory conditions, such as rheumatoid arthritis, where there is a bit of evidence that fish oils or omega-3 fatty acids can reduce systemic inflammation in the body, helping certain conditions such as rheumatoid arthritis. So some of the known effects of these omega-3 fatty acids, the way they exert their action is through reducing production of thromboxane, prostaglandins, and leukotrienes. And in particular, the last two, prostaglandins and leukotrienes, are heavily involved in inflammation in the body. So when you reduce inflammation in the body, it can reduce not only conditions such as rheumatoid arthritis and improve them, but when you reduce inflammation in the body, it can also improve cardiovascular health. Because we now know that inflammation in your bloodstream can lead to blocked arteries in your heart attacks, strokes. So we are always looking for medications that are reducing the inflammation in the body. Okay. Another group that you're going to hear about are non-steroidal anti-inflammatories, such as ibuprofen. They reduce inflammation in the body, and you'll see they're not only used for pain and inflammation. Some people use ibuprofen for chronic inflammatory conditions, which has been shown to prevent other conditions because they're reducing overall inflammation in the body. Okay, so let's just list some foods where we're going to find high omega-3 fatty acids. So seafood and fish, okay, so such as sardines, salmon, tuna, they're all, I mean, I would just remember fish because fish is just high in omega-3s, okay. Eggs also have omega-3. Milk, not really, okay. So I would think of the fish, some of the plant oils, and eggs as being very high.
Okay, so the next herbal remedy is ginseng. And you can see under the indications, it has a variety of potential indications that patients can try it for, such as memory loss or improving memory, Alzheimer's disease. Some patients use it as an aphrodisiac and also for erectile dysfunction. And it also can be used for fatigue in patients with multiple sclerosis. The actions, I'm not going to go into any detail about the actions. The adverse effects, it can cause some insomnia. There's bleeding again, so there's a risk of interaction with blood thinners, and it can cause some hypoglycemia in diabetics. So contraindication, well, pregnancy is going to be listed under many of these. Avoiding this if you have a bleeding condition or if you're on blood thinners, which is very similar to many of the other ones we've discussed. Nursing considerations, toxicity with ginseng would be very uncommon. The symptoms are listed there: nervousness, insomnia, palpitations, and also monitoring diabetics for the potential of low blood sugars. Okay, so medical marijuana, cannabis, or THC. So what would be the indications for this? So the first one, cachexia, is a condition where you're losing your body muscle mass. You have a wasting disease, such as cancer, where you're not eating and your body is losing its muscle mass. Cancer-induced nausea and vomiting. Sometimes cannabis can be used for persistent nausea and vomiting, and can be used for pain related to many cancers, or pain related to chronic syndromes such as rheumatoid arthritis or fibromyalgia. Patients with HIV or AIDS also sometimes benefit from cannabis. Patients with multiple sclerosis, diabetic neuropathy, where diabetics get numbness and tingling chronically in their legs. So you can see it has a widespread use. It's tried for many conditions. What are the actions? So it activates cannabinoid receptors in the central nervous system, producing activating pleasurable receptors in the brain as well. So what are the adverse effects? Well, it can increase heart rate, it increases appetite, it can lead to sleepiness, fatigue, dizziness, dry eyes, red eyes, hallucinations, paranoia, anxiety in some people. So it's very patient specific which adverse effects they get. And a lot of it will depend on what else is mixed with the marijuana, especially if it's used recreationally, what the effects will be. These are medical marijuana is typically with a prescription where you go to a medical dispensary to obtain the marijuana for medical indications.